Senator Hassan.
Thank you, Mr. Chairman, and thanks to you and the ranking member for this hearing, and thank you, Secretary McDonough, for being here today. I have 3 questions for you. The first one has to deal with veterans' feedback. It's really important, obviously, that the VA hear about how the new electronic health record system actually impacts the veterans' healthcare experience. And to build on the comments we heard from Senator Murray and just now Senator Bozeman, a July 2021 VA Office of the Inspector General report found that VA facility patient advocates did not receive direction or training to consistently track and report patient complaints about the new electronic health records system. So how will the VA go about establishing guidelines, training, and a method to capture patient complaints about the new electronic records and ensure that it implements improvements to address patient concerns?
Thanks very much. Just working backwards, I think the OIG focus on the patient advocates is really smart. I think that as a general matter, I think an underutilized tool for us. And so they make some recommendations to us. We've indicated to them that we'll take those and implement those directly relevant to your question. On the question of vet feedback more generally, this I think is an obvious point, but one of the things we have to make a decision about is the portal into the electronic record. And I remember being confronted relatively early, well, very early in my tenure, where somebody said, well, you're going to have to make a decision on the patient portal. And I said, well, why would I make a decision on the patient portal? I'm neither a patient there, nor am I going to be using the portal. Right. So what we did is we pushed that into our Veteran Experience Office. They've just now completed a months-long review, engaged with veteran patients on what they want to see in the various options of a portal. We look to, as a general matter at VA, and this will be a particular concern of mine, ensuring that questions around usability are decided not by Cerner and not by us, but informed by the user.
Okay, good. Thank you. I want to go to a New Hampshire-specific concern now. New Hampshire is going to be one of the last states where implementation occurs. It's currently scheduled for 2026, and that seems pretty optimistic under the circumstances. That's going to potentially create problems for veterans who move from a state like New Hampshire that hasn't yet implemented the new system to a state that has. So what's your plan for ensuring that VA healthcare professionals have consistent access to both old and new electronic healthcare records so that there won't be gaps in care or medical errors from incomplete medical records?
Yeah, it's a very fair question. I guess what I'd say is, as I indicated earlier, this question about the next 2 go-live sites, VISNs 20 and 10. After we get past those, we will be going to a system readiness decision-making matrix, whereby we'll make a decision as to where to go next, and in which case maybe it's New Hampshire based on infrastructure readiness.
Right.
This is also a finding from the IG. Training readiness. We're building this more clinically relevant training facility, and then change management or leadership readiness. So it could be that this is a long way of saying the deployment schedule itself will change. Second, as it relates to ongoing training, we recognize that we're going to have to continue to have an ability to walk back and forth between the two. In an ideal world, that doesn't drag on for more than a decade. After all, we've invested in this.
And I appreciate that. I think just focusing on future outreach needs, so that the system isn't caught short as veterans begin, veterans move around, we all do. So I appreciate that. Last issue is cybersecurity. It's a focus of mine on the Homeland Security and emerging threats work I do. Hospitals are obviously big cyber targets. So how is the VA prioritizing cybersecurity as it implements the electronic health records modernization program and in its continued use of legacy systems?
So we're continuing to make cyber a fundamental priority. It's a personal priority of mine, and I've had basically regular interactions with our CISO. I've also recently asked the director of the National Security Agency and the commander of Cyber Command to come take a look at our systems and make sure that we're in a position to be confident that our highest priority assets are well protected. And I'd be more than happy to make sure, given your personal interest in this, that we have a regular back and forth with you to assure you that we're asking the right questions and making the right decisions.
That would be great. Thanks so much. Thanks, Mr. Chairman.
Senator Round.